Despite millions of Albertans jumping at the chance to get their double dose of a COVID-19 vaccine, the immunization rate in the province has been slowing down. We speak to JC Boucher at the University of Calgary, who has been doing research on vaccine hesitancy about the reasons that some of us might be holding off. JC, nice to see you. First question for you. What are those main reasons that people aren't getting their vaccine?
So the two, vaccine safety, vaccine efficacy, and there's like that kind of efficacy. It's also COVID is not a real disease, hence why would I be vaccinated? And the third one is mistrust in institution. Governments should not mandate, restrict, or force those kinds of things on the population. And we reject vaccination based on our mistrust in institution. So there's a lot of that. And surprisingly, on social media, I'd say something now 50 to 60% of the anti-vaccine narratives focuses on the freedom issue and doesn't focus on the health issues. So we found at this time that much of the conversation kind of piggybacked or kind of basically took over the polarization we saw in our societies between progressive and conservative, where a lot of these questions about rights and freedoms became, kind of confused with vaccination.
And now, are those reasons based around myth, or are these legitimate concerns from people?
These concerns are legitimate. The fact is that we won't know for another 20 years, but based on the best scientific research and our knowledge of vaccines, we think these ones are safe and they work. And in the grand scheme of things right now, all the information we have is that's the case, right? The cases of adverse effects are low. In the grand scheme of things, looking at all the data on unvaccinated and vaccinated people, we show systematically that vaccinated people, are able to fight off COVID more than unvaccinated people, and we see this in the infection rates between unvaccinated and vaccinated. So all the information we have, the best information we have right now is this is good. And this is the right thing to do.
And how could policymakers kind of use this research that you and your group have done to increase vaccination in the province?
Short of a vaccine mandate, we're kind of out of tools in our box. The only thing that other jurisdictions have started to put in place, and we're starting to see in Canada, is a vaccine passport, because essentially it puts in place a policy tool where people can decide whether or not they want to be vaccinated, but then they have to pay a price for that decision. And in all the jurisdictions we've seen this, vaccine uptake actually increased significantly. In Europe, in Quebec, in Manitoba, when the government started to say, we will put in place a vaccine passport, then we got a bunch of people making the decision to get vaccinated, because in the grand scheme of things, they're not really afraid of the vaccine, and they're on the fence on whether it works or not. So they actually don't care about the health elements of the vaccine. What they really don't like is the freedom part. But that freedom has a price, and they're unwilling to pay it, and thus they get vaccinated. So in the grand scheme of things, the vaccine passports are like the last public policy tool that can be put in place by governments to kind of nudge the last 10 to 15% to decide to be vaccinated and make our community safer.
All right, thank you very much for your time, as always. That was Jean-Christophe Boucher, an assistant professor at the University of Calgary. And in Calgary, I'm Jo Horwood for City News.